Hi, my name is Casey Peart, and I'm a nursing student at the University of Pittsburgh.
Hi, my name is Ariella Lakin, and I'm a student nurse at the University of Pittsburgh.
Hi, my name is Catherine Pryor, and I'm a student nurse at the University of Pittsburgh.
Hi, my name is Emily Cunningham, and I'm a student nurse at the University of Pittsburgh.
We are taping in a lab with a lot of background noise, but that's how it is in a hospital, and you need to be able to think through this. What we are going to show you now is how to place a patient in semi-fowler's position. This patient is lying in bed, but there's something wrong with the picture. Can you identify what it is?
We're going to place our patient in a semi-fowler's position. It's usually easier for the patient to breathe and a lot more comfortable for the patient.
We begin by noting that the patient is at a good position at the head of the bed, and then we just raise the bed to about 45 degrees. I'm going to raise the head of your bed. It's going to be a little bit noisy, but this will help you breathe better.
Okay, thank you.
About 45 degrees.
A lot of times on the newer beds, the knee gatch also raises with the head of the bed. You don't want to leave the knee gatch up because of compromised circulation. This is an example of the knee gatch raised.
This position is called a semi-fowler's position, which is half of a full fowler's position, which would include raising the bed to almost a full 90-degree angle. Although this does improve thoracic expansion, it's usually not as comfortable for the patient, so you as the nurse must decide what's best. And here I'm going to demonstrate what a full fowler's position would look like. This bed does go up to a high fowler's position, but some beds may actually be able to go up the full 90 degrees.
The patient is now in a semi-fowler position, and we are going to move her as if she is completely dependent upon us for her movement, which means we're going to be careful for hip external rotation, edema, and pressure points. I'm now going to show you how to prevent hip external rotation by using a trochanter roll. So we're going to pull the blanket back. Take the blanket that we have placed under the patient and fold it over the patient. And you roll it back like this. We do it like this because if you roll it the opposite way, it just ends up unrolling.
I'm now going to show how to prevent external rotation of the hip. So first, I'm going to begin by taking the blanket off of the patient slightly, and then taking the blanket that is under the patient and folding it over. I am then going to roll the blanket towards me, because if you roll it the opposite direction, then it will just unravel. So I'll continue rolling. And then in order to make sure the patient is comfortable, I will gently take her hand and move it. Then I continue rolling until the blanket is securely under the leg so the hip will not be rotating. I'm going to move the patient's arm by holding her elbow and her wrist to make sure that she's comfortable. And then I continue rolling. And make sure you get it really under the patient to make sure that their hip remains aligned.
We are now going to raise the arms to help decrease the chance of edema formation in the limbs. I'm going to take the pillow, lift the arm from underneath, place one pillow here. Then we're going to take our second pillow, raise the wrist, and notice that the fingers are above the wrist, which then are above the elbow. This placement of the patient's arm also helps keep pressure off of the shoulder.
I'm now going to show you how to raise the patient's arm in a way that will promote circulation and prevent edema and also make the patient's shoulder more comfortable. So I'm going to lift the patient's arm and move this pillow underneath. I'm then going to take a second pillow and put it over the first one horizontally. Notice anything wrong with this picture. Her neck is actually not receiving enough support, so we are going to move her forward and then move the pillow down so she is more comfortable. So I'm going to start by moving my arm behind her and putting my other arm around her shoulder. And be sure to keep your back straight and move from the hip so you won't hurt your back. So I'm going to move her forward. And then the pillow is now more closer to her neck so she's more supported.
So to prevent contractures, we're going to do a hand drill to keep her flexors from taking over the extenders. So you're going to roll a towel, and you're going to lift her hand and kind of place the fingers on top, and you want the thumb kind of down.
In order to prevent contractures from occurring, you can easily just use a towel and roll it up to make sure that the flexors don't take over the extensors. And although there are professionally made ones usually provided by physical therapy, this is good to use in the meantime while you're waiting for physical therapy to come. So what you'd want to do is you want to lift the patient's arm up slightly and put their hand over the towel and make sure the thumb is pointed towards the patient medially, and then just kind of spread the fingers out and make sure that the patient is comfortable.
This is not normally how your patient's feet are going to be. When they rest, their feet are going to go into a plantar flexion with their feet toes down, and after a long time this could lead the patient to not be able to walk.
So to prevent this from happening, you put the patient's feet, you can use high-top sneakers, or you can use special devices or some kind of block to keep the patient's feet in a neutral position. We've almost got the patient in a good position. Now we're going to check her spinal alignment. Her head is in line with her midline, and her shoulders are in line with her hips, so it looks good. Now all we need to do is address pressure points.
Now you can either memorize this in your book, or you can just think about where the patient's weight is going to be pushing them down into the bed, or where they're going to be pushing up against themselves, like bone against bone.
I'm feeling a few pressure points right now. Underneath my heels, my sacral area, my shoulder blades, and underneath my elbows.
In order to prevent skin from being compromised, I'm going to put on skin prep on her elbow and on her heel. In addition, I'm also going to use a boot, and they usually look like this, although there are many different kinds out there in hospitals. And I'm going to put this under her foot to promote circulation and help positioning of the foot to prevent skin breakdown. You can use tools like this under the patient's elbows as well.
For the exam, lots of students forget to do some of the important things after you get the patient into a semi-fowler's position. One of the things is to make sure that the side rails are up, the bed is in the lowest position, it's locked, which hopefully it's locked before you started moving the patient, and also that things like the call bell and tissues are within reach of the patient.